Hello, my name is Dr. Alexander Millman, and today I would like to discuss what is a root canal, why would we need one, why can't we just get away with the filling? Those are questions that I often hear from my patients. So let's dive right into this. This app here can show a typical cavity starting to develop. Okay, when the cavity starts, you don't really feel it, and if it's not on the surface of the tooth, you can't really see it either. The cavity can be handled with a filling. We can drill this out, and this will prevent bacteria from going further into the tooth. If the cavity is not drilled out on time, once bacteria enters the nerve, at this point filling a cavity will not help, because now the infection is inside of the canal. This is where the pain starts. Prolonged exposure of infection can cause an abscess at the root tip, swelling, and a lot of problems. So the root canal is necessary when the nerve gets damaged, either by trauma during the accident or by infection, in which case a root canal therapy is performed. A root canal therapy is when we go into the canal and we clean out all the contents of the tooth. The tooth becomes empty inside. We then fill it. Once the root canals are filled, no infection can go past, but the top portion of the tooth remains hollow. So after the root canal, we do have to reinforce the tooth by putting a post into one of the roots and then covering the whole tooth with a crown. Now, the other question I always hear is, why is root canal so painful? The truth is, the root canal does not have to be painful. If the patient is numb, they should not feel any pain. There's two reasons why the root canal would be painful. One is if the anesthesia hasn't reached the nerve and the patient still feels some, even though they feel partially numb, it may not be numb enough. Second reason, even if the patient is really numb but they still feel pain, that reason is contributed to this abscess down at the root tip. So in that case, we would have to stop the procedure, have the patient take antibiotic to clear out this abscess first, and then the root canal will be quite painless. There is a few days of recovery afterwards, but within a week all symptoms should be gone. So hopefully that explains a little better what a root canal is and why do we do one.